This is Australia with all its extensive healthcare services. Indigenous Australians have adequate access to them. So why do they receive worse health outcomes than non-Indigenous Australians? Well, the answer lies with the lack of culturally aware healthcare that they receive. To respond to this, we need cultural awareness training and culturally appropriate healthcare to reduce the inequality in their healthcare. So let's get talking then.
Cardiovascular disease is the leading cause of mortality in both Indigenous and non-Indigenous Australian populations. However, the public health campaigns aimed at reducing the prevalence of this illness do not appear to be as effective in Indigenous communities.
Ask the question.
Indigenous Australians have a higher prevalence of chronic diseases such as diabetes.
Ill health is pretty much seen as a punishment, not so much as a pathological or physiological problem.
It's not until someone conducts the correct ceremonies to resolve this initial issue that they will be completely healed.
They don't have access to the infrastructure and they don't have access to the services, both in terms of things like education and things like the medical services.
So how to tackle this?
Empower the patient.
So it should be a focus for the future to increase the amount of accessible services by increasing the number of culturally aware and competent staff, as well as extra facilities.
Your health staff in cultural awareness and to utilise the ALOs when they're available.
Make a difference.
Health outcomes are really only the tip of the iceberg, and we can't really consider them in isolation without looking at all the other factors.
Fremantle said, "Knowledge is power and it is our job to disseminate it."
These include strong beliefs in the family, social hierarchy and practices around death and dying.
Substance abuse is a major health issue that leads to adverse health outcomes with shorter life expectancies.
To ensure that all Indigenous Australians feel comfortable in attending the doctor.